The midnight dash, a common male dilemma. It's a scenario many men are all too familiar with. We've all been there, gentlemen. That sudden, urgent need to rush to the bathroom in the dead of night. That dreaded moment in the middle of the night when nature calls, interrupting a perfectly good sleep. You wake up, groggy and disoriented, glancing at the clock, and realizing it's only 3 a.m. You stumble to the bathroom, hoping to quickly return to dreamland, but sometimes, it's not that simple. But what happens when those nighttime bathroom trips become more frequent? When it feels like you're making this journey multiple times a night? What if you find yourself going more often throughout the day too? Constantly checking the time, calculating when you last went, and feeling that nagging discomfort. While occasional changes in bathroom habits are normal, persistent frequent urination shouldn't be ignored, especially if you're over 40. It's a sign that something might be off. This could be a sign of an underlying issue, particularly with your prostate. The prostate is a small gland, but it plays a big role in your urinary health. Many men experience changes in urinary patterns as they age. It's a common part of getting older, but it doesn't mean you should just accept it without question. It's common to feel like you need to urinate more often, especially at night. This condition, known as nocturia, can significantly disrupt your sleep and overall quality of life. While this can be a natural part of aging, it can also be a sign of something more serious. It's important to discuss these changes with your doctor. Frequent urination, especially if accompanied by pain or discomfort, should never be ignored. It could indicate a range of issues from infections to more serious conditions like prostate problems. The good news is that most prostate problems are treatable, especially when caught early. Early detection and treatment can make a significant difference. In this guide, we'll delve into the common causes of frequent urination in men, focusing on prostate health. We'll cover everything from benign prostatic hyperplasia, BPH, to more serious conditions like prostate cancer. We'll explore practical lifestyle changes, dietary tips, and steps you can take to regain control of your bathroom schedule and overall well-being. Remember, knowledge is power. Simple changes like reducing caffeine and alcohol intake, staying hydrated, and regular exercise can make a big difference. Understanding your body and recognizing potential warning signs is the first step towards proactive health management. By staying informed and proactive, you can take control of your health and ensure a better quality of life. Beyond the bathroom break, understanding prostate issues. The prostate, a small gland nestled beneath the bladder, plays a crucial role in men's reproductive health. It produces fluid that nourishes and protects sperm. As men age, the prostate can undergo changes that lead to urinary problems, including frequent urination. One of the most common conditions is benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate. Another condition, prostatitis, refers to inflammation of the prostate, often caused by bacterial infections. Prostatitis can cause painful urination, pelvic pain, and flu-like symptoms. While less common, prostate cancer can also lead to urinary issues, highlighting the importance of regular checkups and early detection. Understanding the different prostate conditions that can cause frequent urination is crucial for proper diagnosis and treatment. If you're experiencing persistent urinary changes, don't hesitate to consult your doctor. They can perform tests to determine the underlying cause and recommend the most effective course of action. Early diagnosis and intervention are key to managing prostate problems and maintaining good urinary health. Benign prostatic hyperplasia, often referred to as BPH, is a condition that affects a significant portion of men as they age. This condition is characterized by the non-cancerous enlargement of the prostate gland, which is a small gland located just below the bladder and in front of the rectum. The prostate gland surrounds the urethra, the tube responsible for carrying urine from the bladder out of the body. When the prostate enlarges, it can press against the urethra, much like a clamp squeezing a hose, which can obstruct the flow of urine. This pressure can lead to a range of urinary symptoms, with frequent urination being a hallmark sign. Men with BPH often find themselves needing to urinate more often, especially during the night, a condition known as nocturia. This can significantly disrupt sleep and daily activities. Imagine the urethra as a flexible straw. When the prostate enlarges, it's like squeezing the straw, making it harder for urine to flow freely. This analogy helps to understand why men with BPH experience a weak urine stream and a feeling of incomplete bladder emptying. The obstruction caused by the enlarged prostate can lead to a variety of symptoms. These include a weak urine stream, difficulty starting urination, dribbling at the end of urination, and a sensation that the bladder is not completely empty. This obstruction can lead to a feeling of incomplete emptying, weak urine flow, and the need to urinate more often, especially at night, known as nocturia. These symptoms can be bothersome and affect a man's quality of life, causing frustration and discomfort. While BPH is not a life-threatening condition, its impact on quality of life can be significant. Men may feel embarrassed or anxious about their symptoms, which can lead to social withdrawal and a decrease in overall well-being. The exact causes of BPH are not fully understood, but hormonal changes associated with aging are believed to play a role. As men age, the balance of hormones in the body shifts, potentially contributing to the growth of prostate cells. As men get older, the balance of hormones in the body shifts, potentially contributing to prostate cell growth. This hormonal imbalance may lead to the enlargement of the prostate gland, causing the symptoms associated with BPH. While BPH is a common part of aging for many men, it's essential to remember that it's not an inevitable consequence of getting older. There are steps that can be taken to manage and alleviate the symptoms of BPH, allowing men to maintain a good quality of life. Lifestyle modifications, medications, and in some cases minimally invasive procedures can effectively manage BPH symptoms and improve urinary flow. Consulting with a healthcare provider can help determine the best course of action based on individual needs and the severity of symptoms. Prostatitis, not just a bladder issue. Prostatitis is a condition that affects many men, yet it is often misunderstood or overlooked. It's important to recognize that this is not just a bladder issue, but a complex condition that can significantly impact a man's quality of life. Prostatitis, another common prostate problem, presents a different set of challenges. It is a condition that can affect men of all ages, though it is more common in men under the age of 50. Understanding the nature of prostatitis is crucial for effective management and treatment. Unlike BPH, which involves physical enlargement, prostatitis refers to inflammation or infection of the prostate gland. This inflammation can be acute or chronic, and the symptoms can vary widely from person to person. The inflammation can be caused by a bacterial infection or other factors that are not yet fully understood. This inflammation can cause a range of uncomfortable symptoms, including frequent urination, which can be particularly bothersome during the night, leading to disrupted sleep and fatigue. Pain or burning during urination is another common symptom, which can make the simple act of relieving oneself a painful ordeal. This pain can sometimes extend to the lower back, abdomen, or even the groin area. Additionally, a persistent urge to urinate, even when the bladder is not full, can be incredibly frustrating. This constant need to go can interfere with daily activities and reduce overall productivity. Prostatitis can be caused by bacterial infections, which are typically treated with antibiotics. However, not all cases of prostatitis are bacterial. Non-bacterial prostatitis can be more challenging to treat and may require a combination of medications and lifestyle changes. However, in many cases, the exact cause of prostatitis remains unknown, making it challenging to diagnose and manage. This uncertainty can be stressful for patients as they may not understand why they are experiencing these symptoms or how to effectively treat them. This type of prostatitis is often referred to as chronic prostatitis or chronic pelvic pain syndrome. Chronic prostatitis can be particularly difficult to live with, as the symptoms can persist for months or even years, significantly impacting a person's quality of life. Living with prostatitis can be frustrating and uncomfortable. The persistent pain and discomfort can lead to feelings of helplessness and anxiety, further exacerbating the condition. The persistent urge to urinate, coupled with pain and discomfort, can disrupt daily life and affect sleep quality. This lack of restful sleep can lead to chronic fatigue, making it difficult to focus and perform daily tasks. If you suspect you may have prostatitis, it's crucial to consult a healthcare professional for proper diagnosis and treatment. Early intervention can help manage symptoms more effectively and prevent complications. They can determine the underlying cause of your symptoms and recommend the most effective course of action to alleviate your discomfort and improve your quality of life. Treatment options may include medications, physical therapy, and lifestyle changes, all aimed at reducing symptoms and enhancing overall well-being. Lifestyle tweaks for a happier prostate. When it comes to prostate health, small changes in your daily routine can make a big difference. Simple lifestyle modifications can go a long way in managing prostate-related urinary symptoms and improving your overall well-being. Start by paying attention to your fluid intake, especially in the evening. While staying hydrated is important, try to reduce your fluid consumption a few hours before bedtime to minimize nighttime bathroom trips. Avoid bladder irritants like caffeine and alcohol, which can exacerbate urinary urgency and frequency. Managing stress is also crucial for prostate health. Chronic stress can wreak havoc on your body, including your urinary system. Explore stress-reducing techniques like meditation, deep breathing exercises, or yoga to promote relaxation and reduce tension. Take the first step toward better prostate health. Check the link in the description for more details.